It's like, well, one or two words can dictate your thought process. The person doesn't have cancer, doesn't have HIV, isn't sick, even compromised. She's pretty good. A previously healthy 30-year-old female comes to us because of a 3-month history of progressive shortness of breath and non-productive cough. Stop. So we have a previously healthy 30-year-old female, 3 months of shortness of breath, progressive, it's getting worse, and non-productive cough. Bro, respiratory is huge, isn't it? Because we're going to have either you producing phlegm, a productive cough, or non-productive cough. When you have a productive production of cough, like producing something, a productive cough, you have phlegm, right? You have sputum. Is it green? Is it clear? Is it yellow? Is it red? It tells you something. So just like I tell you, well, we have in the kidney, which we're doing tomorrow, we have nephritic and nephrotic. Is there blood in the urine? Is there frothiness in the urine? Same thing, right? It's one or the other. There's a massive swelling, little swelling. So respiratory is awesome because it tells us little things like this. So one doctor says sarcoidosis. Maybe we'll see. If that's what you think, let's see, right? So you have a previously healthy 30-year-old female, 3 months of progressive shortness of breath, horrible. She's not producing any phlegm. She has had constipation and fatigue during the same period. Okay, she has not traveled recently or been exposed to sick contacts. Why are they telling you that? To tell you that maybe it's not TB. So you want to learn fast. You should be able, all of you, to be able to eliminate all the answers that are wrong. That's where you want to get to. Because not only for step 1, they'll help you for step 2. And then when you go practice residency and then be an attending, all medicine is elimination. I have a 4 or 5 differentials of this chief complaint. I walk in, I ask questions, and by asking questions, I eliminate things that I know are not possible. Ta-da, here's my answer. That's what medicine is. So I know it's not tuberculosis because usually it's, they coughing up, sputum, weight loss, night sweats, chills, exposure to sick people, travel history. So that should be coming in your mind to help you review things, right? Yeah. Okay. So we have an idea of what this patient has? Maybe. Also, let's look at the x-ray. Now, if you're a radiologist, I need you to come on board and help us out in life, right? I love radiology. I have a lot of close friends, but they're always very busy. And I want to do it live, and they're always working at this time, or else I'd have them come on. But if you need to see something, right? AMBOSS has a huge section of radiology, which helps you read everything. But this overlay can help you too. What I look at is I look straight in the middle. I look to the sides, lateral. I see if it's any flattened diaphragms. I don't see any circles or any consolidation here, but I see something here. And I see something here. I don't know. I don't know. I see something weird. It's not supposed to be there. What do you know of a condition that has bilateral lymphadenopathies, right? Inguinal lymphadenopathies. It's actually Hiller. Bilateral Hiller lymphadenopathies. Sarcoidosis. And if you don't remember that, they'll show you, it looks like bat wings. A wing here and a wing here. Bilateral Hiller lymphadenopathies. That's like pathognomonic for sarcoidosis, right? Okay, so let me just get out of this here. We have in sarcoidosis, sarcoidosis, we have many things. Yes. In sarcoidosis, they're always going to tell you possibly about bilateral Hiller lymphadenopathies. So either they're going to tell you that, sarcoidosis, either they're going to tell you that, or they're going to present to you an x-ray on exam like they did right now.